Good morning, everyone, and welcome. My name is Mike Smith, and I'm the President and CEO of Goodwill of Southwestern Pennsylvania. We're very pleased to be hosting this announcement today of a national reentry initiative aimed at reducing recidivism and improving rates of success among those leaving prison. It is something that our Goodwill is extremely proud to be a part of. Before we get started with the announcement, allow me to offer just a brief Goodwill history lesson. Way back in 1919, our Goodwill began providing services to folks in need in the Pittsburgh area. So if you do the math, you'll know that next year we will be celebrating our 100th birthday as a workforce development agency, something we're very proud of. During those 100 years, we've helped thousands upon thousands of people help them enjoy the dignity and respect that comes with benefits of work. During that time, we've served many different populations with employment barriers, including people with physical and intellectual disabilities, people with economic disadvantages, veterans, older workers, and youth whose potential has not yet been reached. But for decades, Goodwill of Southwestern Pennsylvania has also been devoted to helping reentrants obtain workforce training and employment. Therefore, we're extremely proud to be a part of this initiative being announced today. We see it as a tremendous opportunity to work alongside these excellent partners equally committed to finding innovative approaches for people who are incarcerated to successfully rejoin our communities. Please allow me to introduce the partners who will be speaking in the next few minutes. First, Mark Holden, General Counsel, Koch Industries, and Advisory Chairman for Safe Streets and Second Chances. Carrie, Pettus-Davis, Professor, Florida State University Institute for Justice Research and Development, and Principal Researcher for Safe Streets and Second Chances. And of course, John Wetzel, Secretary, Pennsylvania Department of Corrections. This event today is also intended to connect various stakeholders in the community who share a common vision of reentry. Therefore, I'd like to recognize several guests with us today as well. Aaron Mulchaney, Regional Director, Office of Governor Wolf. Barbara Parise, Deputy County Manager, Allegheny County. Valerie McDonald Roberts, Chief Urban Affairs Officer, City of Pittsburgh. Linda Topolewski, Vice President, Workforce Operations and Programs, Allegheny Conference on Community Development. Sarah Gall, Director, Investment Relations, the Allegheny Conference on Community Development. And Connie Clark, Administrator of Alternative Housing and Division, and Housing and Division. And last but certainly not least, Dr. Quentin Bullock, President, Community College of Allegheny County. I have the privilege of serving as co-chair with Dr. Bullock for what we call the Allegheny County Anchored Reentry Consortium, or ACAR for short. Dr. Bullock and I are very proud of the work of ACAR over the past 2+ years that includes various sessions with area providers to share best practices for serving reentrants, as well as hosting a summit with area business leaders in our region to discuss the value of hiring former inmates as they reintegrate into the community. Thank you, Dr. Bullock, for being here as well. With that, allow me to turn things over to Mark Holden, General Counsel, Koch Industries, and Advisory Chairman for Safe Streets and Second Chances. Mark?
Good morning, everybody. It's great to be here. Full disclosure, I'm a New England Patriots fan, so I know I'm starting at a deficit, but it's going to be good stuff, trust me.
Way to kick it off, Mark.
Thank you. I'm setting you up for success like you wanted. All right. No, in all seriousness, it's great to be here today. Thank you so much. I want to first say thank you, Mike and Goodwill, for hosting us and for being such great partners on these issues. I want to also thank Carrie Pettus-Davis, who you're going to be hearing from, and her team for working so tirelessly on this project as we just started a few months ago. We're very excited about it. Carrie will talk about that some more. And to Secretary Wetzel, who really is the reason why we're in Pennsylvania. When we started the pilots, we wanted to be where he is because we've seen him and what he does. We think he gets it just right. The whole idea of rehabilitation, making people better so when they come out they don't reoffend, and keeps communities safer. So the big reason we're here, and thank you for all you're doing and your team's doing. We really appreciate it, and we know there's some difficult things going on in your prisons right now. I hope everybody is safe and healthy and everything works out. So I want to also thank everybody who's here today to taking the time to attend this event. We appreciate your support, and going forward, we're hopeful that you'll be a part of this as well, because this is truly going to be a community-driven effort that we're trying to start here and are starting here. Just want to set the scene. You probably all know the statistics. There's somewhere around 2 million people or so are incarcerated in the United States in prisons or in jails. 95% of them or so are going to return to society at some point. So it's not a matter of if, it's a matter of when. And so it's up to us how we want to make that happen, what it looks like when people come back. And so what we're trying to do with our program is to change the trajectory of the way the statistics look now. The statistics show that basically, sadly, about 75% of the people who are released from prison will be back in touch with the system within 5 years. And history and common sense, though, show that there are ways to fight against that, to break through that barrier that we've erected here. And really, what it's about is rehabilitating people while they're in prison. And we know when that happens, if we focus on that, if we focus on getting people better and not punishing them more, we know that what happens is it improves public safety. It reunites families, keeps communities safer, makes law enforcement's jobs easier and safer, and it gives people real second chances after they've paid their debt to society. And ultimately, it will save billions in taxpayer dollars. We know this approach works. We know an evidence-based and data-driven approach works. How do we know this? Because of the many states that have enacted criminal justice reforms, including Pennsylvania. But Texas, for example. Texas, in the past 10 years, you may not know this or not, Texas, hang 'em high, Texas, deep red state Texas, they've closed 8 prisons. They've saved over $4 billion in taxpayer money, and they've got a crime rate that they haven't seen this low since the 1960s. Georgia also cut its imprisonment rate by 24%, has saved taxpayers almost $500 million in savings, has fewer people in prison compared to 2011 projections, and has its lowest crime rate in a decade. South Carolina, similar story. Its prison population has been reduced by almost 20%. It's closed 6 prisons and saved taxpayers close to $500 million. More importantly, besides the money, besides the statistics, are the lives that are changed. We know from research, we know from the data, again, data-driven, not guessing, not fear and emotion, but the data-driven practices. We know that if you have in-prison programming, the individuals who take advantage of that are 47% less likely to recidivate, to show up back in prison again. We know that for every dollar spent on in-prison programming, whether it's education, vocational, whatever it might be, defrays up to $6 of future incarceration costs. So this is really a no-brainer. Even a New England Patriots fan knows that. What we want to do, though, is also focus on how popular this issue is. Look, I grew up during the whole Willie Horton era. That was a disaster. The tough on crime era. We're talking about smart on crime, soft on taxpayers. And what we've learned in our polling that we've done, and we've done a lot on this issue, over 90% of the people we've polled, and these are likely voters in midterm elections, they say 90% say it's important to rehabilitate people and not just punish them. Nearly 80% support reforming the criminal justice system to focus more on rehabilitation instead of just punishment. And by a 2-to-1 margin, voters believe that rehabilitating those who are incarcerated would do more to prevent and deter crime than making prisons as hard and unpleasant as possible. So the public gets it too. 70% of likely voters support the First Step Act, which went through the House of Representatives. It deals with federal prisons and rehabilitation programs that will be in federal prisons. 70% support that. It got through the House 360 to 59. That's a huge vote, bipartisan vote. And this will give people the tools that they need to re-enter society safely and more successfully than we've been able to do in the last 30 or 40 years. Now, thanks to what Carrie, Pettus-Davis, and her team are doing, their team of researchers at the Florida State University Institute for Justice, Research and Development, we also know that incarcerated people want to transform their own lives. It's not a big surprise. Any of you who have been involved with people who have been incarcerated or been incarcerated, they want the same things we want. We just haven't made it easy for them to be able to get that. You know, none of it surprises me. I grew up in Massachusetts. I was a prison guard when I was in college, and a bunch of kids I went to school with were incarcerated, and they wanted a way out. But back then, there were no pathways to success. We didn't have any off-ramps, for people to have an opportunity. We made it really difficult to succeed once you had a touch with the justice system. That has changed, as I was just mentioning, in different states over the past 10 years, and it's changed for the better. And so what we know now, for example, from the data that Carrie and her team have put together, their data shows that incarcerated men, they want to work 4 times as much as they currently do in prison. Incarcerated women, they also want to work only 3 times as much as they do currently in prison. Women work harder than men anyway, so that'll probably be more than what the guys who work 4 times. Both men and women want to spend twice the amount of time learning as they currently do in prison. And both groups also want to spend more time practicing a faith and developing personal relationships, both of which are keys to a successful reentry and what we'll focus on. So Safe Streets and Second Chances, we hope, Safe Streets and Second Chances is a new program. It's focused solely on reentry. Right now, we've launched in 4 states. It started in January. We're in Texas, Florida, Kentucky, and of course, Pennsylvania. It's a collaboration, as Mike mentioned, between Koch Industries, the Texas Public Policy Foundation. John Kufos, my friend over there, is with Right on Crime, the Texas Public Policy Foundation. He's focused on policy issues. So when we're in a state where we think there's an issue, like an occupational license issue that keeps people from succeeding and getting back on their feet, or some other issues, John will work with you all in your communities. He'll work with people like Americans for Prosperity. One of my friends is here with that organization today to break that barrier down so there will be an opportunity. So we're combining the best in research, we think, with the best in public safety and advocacy and lobbying. We think together that's going to be the thing that will change the dynamic. And so we're working with correctional departments, reentry providers like Goodwill to figure out what are the best approaches. We don't know what works best. We don't have all the answers. We want to learn from you all. We have some ideas, and we're going to try to scale it up over time. And it's all going to be based on the data and the evidence-based practices. And so our whole vision is that the planning for the reentry back into society for incarcerated people needs to begin day 1 of incarceration. Not 60 days out, not a year out, day 1. We also believe every single person who ends up in the system should have a personalized reentry plan as soon as possible once they're incarcerated. Our message is that this is not the end of the line. With Safe Streets and Second Chances, working with local providers and you all in these communities, it's a beginning for a new hope for those who want it and are willing to try to get it. So we're so proud to be in Pennsylvania, as I mentioned earlier, with Secretary Wetzel and all that you all have done in the prisons, whether it's helping people with substance abuse issues while in prison to get better, creating reentry programs for inmates suffering from mental illnesses, helping former inmates who are incarcerated as juveniles transition back into society. We're also very excited with your Clean Slate Act that you just passed. That's great. Let's do some more, because there's a lot more that needs to happen, but we think that's a great start to help people get a second chance in life and not be judged forever for what happened on their worst day. In short, Pennsylvania is taking the important steps towards creating a fairer criminal justice system and creating opportunities for those who have made a mistake, who have served their time, paid their debt to society, and are eager to rebuild their lives and support their families. So with that, I'm going to turn things over to Carrie. She's going to discuss the incredibly important work she and her team are doing. And I want to say thank you again for being here today. Thank you for welcoming us, and hopefully we're going to achieve great things together. Thank you.
Good afternoon. Thank you, Mark, for the introduction and your tireless commitment to criminal justice reform and your vision setting for the Safe Streets and Second Chances initiative. It is a true honor to collaborate with you. I would like to echo Mark's sentiment and just say how fortunate and thrilled that I am to be conducting research in Pennsylvania. Secretary Wetzel, the leader of the Pennsylvania Department of Corrections, is known nationally as a thought leader in adopting and implementing evidence-driven rehabilitative programming. And in our partnership with him and his team, it is quite clear why Secretary Wetzel has this glowing reputation. And thank you, Mike, for the history lesson on Goodwill. When our research team was meeting with community partners in Pittsburgh, we repeatedly were pointed to Goodwill as a leader in reentry work in the region. Our research team has since been so lucky to meet with leaders of Goodwill and staff at Goodwill. In all of our planning sessions, the commitment to research and innovation is very deep and inspiring and clear. So I will spend the next few minutes talking about the research occurring as a part of the Safe Streets and Second Chances initiative. The goal of this research is to build the capacity of existing reentry service providers to deliver state-of-the-art reentry services to all incarcerated individuals, beginning as early as day one during a person's incarceration experience, and reaching well into the community after the individual has released from prison. In turn, individuals who release from prison will have increased well-being and success, which will result in greater public safety and lower recidivism. In each of our 4 states that we are working in, we are working towards this goal by conducting a randomized controlled trial of a highly innovative model called the 5-Key Model for Reentry. The 5-Key Model for Reentry was developed by a team of researchers, practitioners, corrections professionals, and formerly incarcerated individuals. The team was an ambitious team and reviewed 107,515 studies from around the world to figure out how to be at the cutting edge of reentry success. So the 5-Key Model aims to improve 5 factors critical to an individual's success. That includes improving healthy thinking patterns, effective coping strategies, meaningful work trajectories, positive social engagement in communities, and positive interpersonal relationships with others. It's a highly adaptive and individualized model, and the amount of programming that a person receives is really based on their hopes, their aspirations, and their needs when they enter services. So how is this research designed? We are recruiting 2,200 individuals across the 4 states who plan to return to one of 12 counties, both rural and urban counties across these states. Reentry service providers on the research team begin reentry planning with the individuals prior to their release from incarceration. Then the reentry service providers deliver the remainder of the 5-Key Model to individuals for approximately the first 9 months of their release. The research team collects data directly from these individuals prior to their release from incarceration, immediately after their release from incarceration, 4 months later, 8 months later, 15 months later. So we see how they're doing on a whole host of factors. Then we'll continue to collect recidivism data for at least the next 5 years. So we began study recruitment and the actual data collection across these 4 states in May of this year. So far, we've already recruited 1,300 individuals into the study, thanks to our wonderful field teams in each of the states. So I suspect you want to know what this research looks like in Pennsylvania. So to date, we've recruited 280 incarcerated individuals who plan to release to Allegheny County, Fayette County, or Washington County. We aim to recruit a total of 400 individuals. Of the 280 that we've recruited so far, 26 have released across these 3 counties. And we're recruiting people from 12 correctional facilities in Pennsylvania, and so I'll tell you which facilities those are if you forgive me for mispronouncing half of them. I'm from Arkansas. I live in Florida. Banner Township. The facilities we're recruiting people from are Banner Township, Rockview, Laurel Highlands, Hootsdale, Greene, Fayette, Pine Grove, Forest, Kehana, Boot Camp, Albion, Mercer, and Cambridge Springs. So we aim to get a truly representative sample of people releasing from incarceration. Therefore, we were recruiting into the study all individuals who plan to release between, or who are going to release between August 1st of 2018 and January 1 of 2019. And that's despite their criminal backgrounds, and it's really important to learn how to best serve everybody releasing from prison despite their criminal backgrounds if we're truly going to impact public safety and reduce recidivism. So to my knowledge, this is the largest randomized control trial of a reentry program of its kind. Therefore, it was critical to select high-performing partners, which is why we chose Pennsylvania as one of the first pilot states. Under Secretary Wetzel's leadership, the Pennsylvania Department of Corrections is highly receptive and hungry for continual research and improvement of rehabilitative supports. Similarly, under Mr. Smith's leadership, Goodwill is always seeking how to provide state-of-the-art, highly adaptive reentry services to individuals, and especially the most marginalized and vulnerable individuals. Secretary Wetzel has opened up his correctional facilities to our research team, as has Mr. Smith. The reentry service providers on our research team are physically embedded in Goodwill's offices, and study participants receive 5 key model supports in the Goodwill locations. Once the research study is over, our team will train existing Goodwill staff on the model so they can continue to use the 5 keys and also train others in the region. I want to wrap up by thanking everyone here for their commitment to this critically important issue, and thank our local research team here in Pennsylvania, who's in the back row of the audience over there. And now I have the great pleasure of turning over the mic to Secretary Wetzel, the fearless leader of Pennsylvania Department of Corrections.
You good? Does that make me look skinnier? Got to give it a shot, right? Thank you all so much for coming, and certainly for our partners. Thanks for hosting us, and for you guys to fly in here to Pittsburgh. We certainly appreciate it. Reentry is such an important issue for us, and certainly I appreciate you recognizing that Pennsylvania is really one of the leaders. But one of the reasons we are is because of the great staff we have. And we have some parole folks here who are obviously the front line of reentry for us, and also our head researcher, Brett Buckland, is in the back. It's really part of our DNA is to actually measure outcomes, and when something doesn't work, to stop doing it, and when something does work, to scale it. And so this is really consistent with what we're trying to do. I'm also fortunate to work for just a great man, and that's Governor Tom Wolf, who from the day I met with him, for the first time I interviewed with him, his commitment to this issue, to reentry, was very obvious to me, or frankly, I wouldn't be here. And what I like most about Governor Wolf is that he focuses on the problem and doesn't look at problem solving through a partisan lens. And you can see just by the makeup of this initiative, right? This is not about the right or the left. This is about people and outcomes. Now, for the Southwest in particular, we're going to release 8,000 people from state prisons to Southwest Pennsylvania. 8,000. You're going to run into somebody almost on a daily basis that's been through one of our prisons. So the notion that Pennsylvanians aren't invested in our ability to create an environment where people can get better, where people can be corrected, it's foolhardy. From a financial standpoint, if we're just incarcerating people and not trying to add value to their life, not trying to rebuild them or give the opportunity to rebuild, they're just going to continue to come back, and we're going to spend money over and over again. And frankly, government at its best spends money once. It puts an individual on the continuum, and you can talk about whatever continuum, education, behavioral health, criminal justice. It puts them at the step on the continuum that we're most likely to get the best outcome. And when we do that, they don't have to come back. They don't have to use government services anymore. And that's the essence of what we're trying to accomplish here. Now, we know when folks come to us, they come to us with challenges. 40% don't have a high school diploma coming through our front door. 75% plus addicted to substances. About 29% suffering from mental illness. This is a challenging group. And people talk about reentry and talk about recidivism reduction, but the reality is it's damn hard to do and accomplish. And it's impossible if you're going to try to do it yourself. This is not a criminal justice problem, it's a community problem. So the solution has to be a community-based solution. One of the reasons we're out here, and John Rago in the back from Allegheny, who we've worked with for my entire 4 decades in this job. I'm just kidding, it's only been 7.5 years. Just feels like 4 decades. What I've seen in Allegheny, and in the Southwest in particular, more so than anywhere else in the state, is people working together to solve problems. And you don't have as much of the parochial stuff here as you do in other places in the state. So I believe Couple that with 8,000 people coming back here, this is our best opportunity to really prove a concept and really learn at how we can do better. Now understand, our approach with research it's not a pass-fail situation, right? No matter what, whether we're doing something that works or don't work, we're still gonna release 8,000 people back to this area. So we learn as many lessons from things that don't work as we do that do work. So I think sometimes people are afraid of outcomes and afraid of publishing numbers, but good public policy adjusts based on accurate data. And that's really what this initiative is about for us. And it's really consistent with other things we're doing in the Wolf administration. I mean, let's face it, we're in the most significant opioid crisis we've ever had. I mean, obviously, one of the elephants in the room is we just locked down the entire prison system yesterday because we've had 29 staff members exposed to some drug, what's likely some K2 kind of stuff. And so we're in a real crisis. And again, these answers are a group answer. So again, appreciate this. We're really excited to work with all of you. Our community partners are critical. I mean, we have Allegheny Community College here. Folks need education to live a successful life. Why can't some of that education start right when individuals are in prison? Why wouldn't we do that? And trust me, we're one of the states that are doing the Pell pilot, and I certainly get criticism because why are we spending this money on people incarcerated? Because it makes sense. That's why we're spending it. And because we're all invested in individuals coming out of prison and not committing more crimes. But beyond that, people coming out of prison and being the best people they can be. Like when you talk about crime prevention, I don't know how you can talk about crime prevention and not talk about preventing people coming out of prison from committing more crimes. And frankly, we have to give them the tools to be successful to achieve that. So we're going to open it up to question and answer. I mentioned the lockdown of our prisons. After we do this, anybody who wants to talk about that, which I'm sure none of you do, we can go over to the side here and I'll answer most of your questions. Maybe a couple I'll dodge, but for the most part, I'll answer most of your questions after that. But if we could just keep the question and answer in this period to be this Safe Streets initiative, I appreciate it.
All right, first let me help me thank Secretary Wetzel and our speakers for being here today. And this is a press conference, so that does mean questions and answers. So at this time, we will take questions and answers. Are there any?
Can you talk about the reentry services that are currently available right now?
Yeah, so we deliver reentry services in several ways. You want me to stand up? Yeah. Just yell at me, it's cool. Could you come to the microphone? Yeah. You got it. So the question was, what reentry services do we currently have? And we have actually a pretty well-resourced reentry continuum. So we have basically 2 lots of reentry. We have residential lots, so that's comprised of different halfway houses to include drug and alcohol programs for individuals with mental illness, and then just general halfway houses. And then we have a bunch of non-residential lots, things like workforce development, mentoring. Brett, help me out here. Outpatient drug and alcohol, outpatient batters, outpatient mental health, housing assistance. Housing is a critical area in all behavioral health realms and incarceration, so giving individuals the ability to get permanent housing is a key part of that. One of the things we're expanding to now is we're actually going to be contracting for detox beds. That bid will be out in a couple weeks, maybe government time, which means a month or 2. So if there's any providers in this area who provide detox services, obviously it's a big need for us, so that's another area of current reentry. In addition to the work our parole folks are doing, we have parole agents that are called ASCRA agents that specifically provide programming and guidance to parolees in addition to the work that their parole officers do. So that's, in a nutshell, that's our reentry continuum. Thank you.
Next question.
Will Goodwill be the only facilitator for the 5-key model? And if not, what would qualify an organization to implement that model?
Sure. So during the course of the study, because this is a pretty controlled, randomized controlled trial, Goodwill is the only provider. And then after this next 20 months or so, and we learn and we refine the model, we'll be training Goodwill staff who will be available to train other people in the model as well.
Where does the funding for this program, this research model, come from? And is there a dollar amount put to it?
It's from Charles Koch Institute, from Koch Industries, but mostly the Charles Koch Institute for each of the pilot programs.
And how much?
4 million. It's for each of the we got 4 pilots, so it's $1 million each.
Further questions? Yes.
Could you talk a little bit more about the, sort of politics of it that you alluded to, of having a Democratic administration and what people might perceive to be a conservative organization?
Yeah, and with this disclaimer, I'm not speaking on behalf of Governor Wolf. We're a couple months from an election. I don't want to put my foot in his mouth. But I think one of the things that frustrates me, and I've been in public policy for 30 years, one of the things that frustrates me is that we're in this time where everything we look through a Republican lens or a Democratic lens, and it's ridiculous and it's ineffective. And the notion that we're going to solve this difficult problem, and I don't think there's not many more difficult issues than having somebody who's incarcerated at the state level. And what we know about people who are incarcerated at the state level is they've been arrested between 7 and 8 times, right? They're likely to be addicted, they're likely to be undereducated, and for them to be successful when they get out is a difficult problem. If the only thing we're going to do is look for Democratic solutions or Republican solutions, we're going to continue to fail. And you heard 75% people fail after 5 years. That's unacceptable. There's not another realm that you would be okay with that. And we shouldn't be okay with it here. So one of the things that Governor Wolf, from the day he walked in the door, has hammered is that we need to find solutions. Not Republican solutions, not Democratic solutions, not solutions by department, right? We have to wrap the solutions around the individual and whatever that looks like. So, I mean, certainly there's areas, I think it's pretty safe to say that the governor would not agree with the Koch brothers on, right? That's not a newsflash. But this area in particular, everybody agrees. What we want out of the system is that when someone comes in the front of the system, when they leave the back end of the system, they're less likely to commit a crime. It's that simple. That cannot be solved by one side or one entity or one department.
Agree with what Secretary once said. One thing I'd add, we try not to look, as much as people think we're all about the politics, we try to not be just a political issue. This is a policy issue. This is a human being. This is an issue that impacts everybody, whether they know it or not. And so we're very focused on communities, and we're very focused, and we have been on criminal justice reform for about 12 years now. And there's a lot of reasons for that, but it's one of those issues. If you look at the history, I meant the Willie Horton era, and before that, the war on drugs and all of that mess, in my opinion. And you look to where we are now, it's really one of the few issues, both at the state level and national level, where left and right, center, whatever you are, come together, because everybody believes in some part of it. And like what we like to say is we look at it from a moral perspective. We look at it from a constitutional perspective, the criminal justice system. Then we look at it from a fiscal perspective. And the moral perspective, it gets back to we really do have, and this is no disrespect to anybody who works in the system. I have utmost respect for everybody in law enforcement. I have family that do it. My point is, though, our systems are all set up this way, including the criminal justice system. It's a 2-tiered system. And so you have the rich and rich get a much better deal, no matter what, than anybody else. And if you're, under-resourced, in poverty, you get pretty much run over in our system. And we don't think that's right. We don't think that's just. The constitutional case is pretty simple. 40% of the Bill of Rights deal with criminal justice issue, the 4th, 5th, 6th, and 8th Amendments. And a lot of what we do in our criminal justice system is inconsistent with that. So that's an issue for us. And then the last piece is the fiscal keys, the fiscal part of it. And the fiscal case, the fiscal issues, they become the moral issue at the end of the day. Because if you're not locking up people who don't need to be locked up, and if you're actually rehabilitating people so when they come out they don't reoffend, they become a taxpayer, and if you're doing like they are in Texas, closing prisons down, consistent with public safety, keeping people safe, if you're doing all those things, people get a second chance. They're with their families. It keeps law enforcement safer. You're not spending all this money on locking people up. Instead, you can spend it on schools. You can spend it on roads. You spend it on mental health issues. And that's the goal at the end of the day. is to have a smaller prison system consistent with public safety. And as Secretary Wetzel said, not having 75% of the people come back, because at the end of the day, that's just atrocious on any level. So it's not even a political issue for us, but to the extent it is, it's one that actually left and right agree on. And I think that's really great given where we are in society today.
And I'm going to jump in on this question too, because I can't. So I just also want to point out, this is a highly research-driven initiative, and research is apolitical. Right, research is about finding facts and disseminating those facts and that information. I will also say that I've been doing work in the criminal justice space my entire adult life, which is a few years over 20 years, I will say. And this is the first time in that over 20 years of work, and I was a social worker for most of those years before I became an academic, so. Now I'm boring, then I was cool. But for my entire adult life, this is the first time that I see nationally that there is a moral will, a fiscal will, and a political will to seek research and data on how to do things better. So we all got in this mess together of over-incarceration in the United States and over-criminalizing behaviors, and now, for the most part, there is, across the political perspective, a will to do things differently and a seeking of evidence. And we, as a country, need to have that evidence to produce in order to give people solutions and suggestions. And that's really what this initiative is trying to accomplish.
Additional questions? Yes.
Could you just clarify, did you say with the timeline you've already begun the research?
Yes, yeah. So we started recruiting participants into the study May 1st of 2018, and we've, across the 4 states, recruited 1,300 of the 2,200 that we're recruiting into the initial study. And then the initial phase of the study, we are looking to expand to other states, but the initial phase of the study will be complete in March of 2020. But one of the other things that's really unique about this initiative is that there's a little fun fact, I don't know, it's actually not so fun of a fact that you may or may not know, is that it takes an average of 17 years from scientific discovery for those findings to be adopted into the real world. And in this initiative, we're trying to reduce that lag time into almost real time. So we're actually analyzing our data every 3 months, refining refining our approaches, and then putting those refined approaches into practice. And this actually took us a couple of years methodologically to figure out how you can do that and still do a clinical trial or really highly rigorous research.
Further questions? Yes.
This is actually for any of you. Is there a component of the research that's going to incorporate demographics such as veteran status into it? And are there particular case managers who are dedicated to that?
Yeah, I think that's a really great question. So we're serving everybody who's getting out during that August 1 to January 1 release window. And one of the things that we're looking at across states is, are there certain subpopulations or subcharacteristics, of individuals like veterans, like gender, like people with serious mental illnesses versus not, who respond differently to different types of approaches. So one of the benefits of having such a large number of individuals going through the study and individuals releasing to both rural and urban communities is that we can see what works specifically for whom and how it's actually working. And then we can specialize to the extent that we need to as we go along. But our policy partners, John Kufos in the back of the room with Right on Crime, is also really focused on if there's policy or structural factors within states and at the federal level, like for veterans, that can be refined along the way, because we want not only for the individuals to have all the tools to succeed, but for our public policy and our organizational practices to not get in the way of their success.
So I'll just add specifically on veterans in Pennsylvania. We have a couple initiatives. Obviously in Allegheny County, the Veterans Court and Judge Zatola working with Duquesne Law is really a groundbreaking approach. Within the prison system, we have several veteran service units. Actually, we're going to announce the first, we believe in the country, female veteran service unit. It was supposed to open tomorrow. I screwed that up with the lockdown, so we're going to be rescheduling that. But so we have this infrastructure where we put veterans in a veteran-specific housing unit. We also have veteran-specific halfway houses where the Department of Corrections pays, I believe, the first 60 days, and we flip them over to the VA. So we've had that partnership in place, I think, since 2012 or 13. Beyond that, the governor has a veterans task force that represents all different agencies. So we have a very big infrastructure, and I think, to your point, it'd be very interesting to see. Hopefully we get enough veterans. It's about 7% of our population, so I assume it should be 7-ish% of the people who get out. So it'll be interesting to see if, given the richness of services for veterans in this system and in this state, if we'll get better outcomes for that group. So I just want to kind of wrap this up and say thank you very much. Anybody wants to talk about lockdown, I'll be on this side. Anybody wants to talk to the people who are actually doing the work, they'll be on that side. That way we can keep this straight. And thank you so much for coming. Thanks for hosting.